Welcome to Bench to Bedside, a weekly series of live conversations about recent advances in cancer, from the research bench to treatment at the patient's bedside. And now, your host and the director of the University of Kansas Cancer Center, Dr. Roy Jensen.
We have made incredible leaps forward in the treatment of cancer, but nothing compares to preventing cancer from ever developing in the first place. While cancer can develop sporadically, some cancers may be preventable. As we increase our understanding of how cancer develops, these findings help guide researchers who are looking at ways to prevent cancer. Hi, I'm Roy Jensen, director of the University of Kansas Cancer Center, and February is National Cancer Prevention Month. With me this morning are Drs. Christy Beffert and Edward Ellerbeck, who lead our Cancer Prevention and Control Research Program, alongside Drs. Jennifer Klemp and Dr. Nikki Nolan. Good morning.
Good morning.
Just to start off with, and should be obvious, but for those that don't understand the issue, why is cancer prevention research so critical?
Well, I would say there's really nothing more important than preventing cancer to begin with. Not only does it save lives, but it saves tremendous burden that people go through when they're diagnosed with cancer and going through treatment. And it's really the number one long-term strategy for reducing the overall burden that we face.
Mm-hmm. So what are some examples of major findings that have decreased overall cancer incidence? Because just a few months ago, well, about 2 months ago, the big ACS study came out showing a 2.2% decrease, which is pretty exciting.
I think we have to talk about smoking if we're going to talk about cancer prevention. So, Ed, go ahead.
Yeah, one of our biggest efforts here has been to work on research that can advance areas to improve smoking cessation. And if you look at the biggest effort to decrease cancer over the last century, it has been the reduction in the number of smokers and smoking-related cancers. But we're only partway there. And in fact, even here in Kansas, one of the reasons why our health rankings dropped in the state of Kansas is because we haven't been able to experience the same reductions in smoking levels as have been seen in other states around the country. We've kind of plateaued. And so our teams are specifically looking not only at what are the best treatments, both behavioral and pharmacologic treatments we can use for cancer, but how we can actually deliver those types of treatments better to the communities and the clinics and the people that need them most. And in particular, that becomes our American Indian community, who's very, very disproportionately affected by smoking and smoking-related cancers. Our justice-involved community, those who've been involved with the justice system. African Americans have been disproportionately affected, and those living with mental illnesses and living in poverty. We're particularly interested in trying to improve smoking cessation rates in rural communities as well.
So, as you mentioned that, could you tell us a little bit about your specific focus around smoking cessation and kind of how you got into that?
So I'm a primary care physician by training, and as I've been looking at primary care, the number one thing I could do for my patients when they come in is to help them quit smoking across the board, controlling their blood pressure, controlling their cholesterol, their diabetes, almost exclusively smoking becomes the most important thing we could do, and yet it was constantly being dropped from the agenda. And so I was very interested in how we could improve the rate of utilization of smoking cessation treatments within primary care. And then furthermore, we were also finding that people would actually initiate treatment for somebody with smoking and suggest that they get some counseling, or they might prescribe them a medication, but then send them on their way. And we know that even with the best medications, 70 or 80% of people are going to fail in a smoking cessation attempt. So we've been looking at how do we actually get people re-engaged in treatment and treating smoking cessation much more like a chronic disease. It is a lifelong struggle that people have when they're dealing with smoking. And we need to recognize that as we're dealing with it in primary care.
My father quit smoking in 1964, and until the day he died, he said every morning he woke up he wanted a cigarette.
That's probably the same year, roughly, that my father quit, right after the Surgeon General's report. He didn't tell me about his lifelong struggles, but we actually have lots of people referring to their cigarettes as their best friend because when they smoke, they've gotten a reward every time they smoke. It is a very, very hard thing to quit, and then for many people, it is a lifelong struggle then.
Yeah. If you're just joining us, we're here with Drs. Beffert and Ellerbeck talking about the latest research and interventions related to decreasing cancer risk. And Megan Peters is here in the studio to take your questions. And I see that we already have a question. So Megan, fire away.
So the first question is, will the uptick in vaping reverse the strides that we have made in reducing lung cancer?
Well, that's the $10 million question. That is our real concern.
I'd say it's more like a $10 billion question.
Yeah, actually, maybe even more than that. We've got a whole new generation of youth hooked on nicotine. We were making great strides in reducing cigarette and nicotine consumption among youth, and with the advent of vaping, in particular the pod devices. And remember, these new devices are actually being redeveloped every day. So as the regulations have taken effect on devices like Juul, now we have new disposable devices that are increasingly popular and still have a lot of the flavoring. So it's a real concern. So what are those kids going to do with the nicotine addiction? First, we don't know what the lifetime effects are related to the nicotine addiction alone. And then some of them are converting back into cigarettes and other forms that we know are hazardous and cause cancer. Mm-hmm. It's a shame because there was the potential of actually looking at these types of devices as smoking cessation aids, but they haven't gone through the FDA regulation process that our other strategies have. So we know that patches, gum, lozenges are all safe to help people quit smoking. We don't have that same data with any of these e-cigarettes or vaping devices. And in fact, the vast majority of people who use vaping devices don't successfully quit. Some of them become dual users of vaping and smoking. But.
Yeah. So I should probably also remind our audience that for people you think might benefit from this discussion, please use the hashtag #BenchToBedside. So Dr. Beffert, what would you say are some of the challenges that we face in cancer prevention research?
Yeah, so, we've made a lot of really heroic strides in cancer treatment, and some in cancer prevention as well, but I like to think of it using the Institute for Healthcare Improvement analogy. Rather than throwing rocks at a target, we're trying to get a bird to go to a target, which is a totally different mindset in terms of the type of research you're doing and the types of interventions you're trying to develop, because you're trying to really understand the underlying causes, focus on motivation, and set up an environment where that bird's going to want to fly to that target. Mm-hmm. And it's not just, patients and community members, it's also the people that run our healthcare, that design communities, that create our systems, because we know we can't rely on people to just have sheer willpower to change their lifestyle, for example. They've got to have the support and the environment where it's the easy decision to make. Mm-hmm. So it's complicated, and it's maybe seen as a little bit less heroic, but it's a lot more day in, day out, hard work. I think of it like what it takes to stay happily married for 50 years. I mean, it's a different kind of work.
Yeah. So there's a lot of interest in the lay press around cancer prevention and healthy diets and all that kind of thing, and I constantly see headlines touting the latest cancer prevention tips. What suggestions do you have for our audience in regards to filtering through all of this? I won't call it information, I call it kind of noise.
Yes.
And to discern information from all of that.
Yeah. So somebody once told me, if you're trying to be attuned to, unnecessary influence, that if there's an urgency attached to it, like it's something you got to do right now take it, it's going to disappear, then beware. And when we look at diet, for example, or lifestyle factors, it's really the core things that we've known for 50 years that are the most important in terms of eating a balanced diet, not going for the quick fixes, not going for a magic bullet. There's resources out there too that you'll want to look at that are going to give you, a straight answer and not, go off on something that has maybe one study to support it. Like the American Institute for Cancer Research is a great resource for that.
So it looks like we have some more questions. Megan, could you tell us about those?
Absolutely, and these relate to what you were talking about diet. We have someone who had breast cancer, stage 1A, ER positive, PR positive, and had genetic testing that confirmed it was not genetically linked, and had a clean mammogram in November, wants to lead a healthier lifestyle to prevent the cancer from ever coming back. And she would like to know if there's a diet that's more beneficial to this goal, such as keto or low inflammatory foods. And in addition, because hers was hormone positive, should she avoid foods that have hormones in them?
Great question. So the thing is with diet, the real trick is picking something that you're going to be able to maintain. And there's been some really good trials that have done head-to-head comparisons of different types of diet, high fat, high protein, different popular diets. And when you look at the outcomes of those trials, the further out you go, the more similar they are. In the short term, sometimes certain approaches may look a little bit better in terms of impacting certain biomarkers, but in the long term, what really matters, and when I say long term, I mean, look out a year or two. What really matters is what can you maintain? What can you keep up? And so that needs to be really at the forefront, I think, of people's minds before they jump into something that may be, in fact, too extreme for them to keep doing in the long run. Because what you want to avoid is, totally doing a radical change, but, flipping back and having that sort of cycling that happens, in addition to the kind of failure that people can end up feeling as a result.
Right.
So I would say that's the most important thing, and stick to the basics in terms of high fruit and vegetable, whole grains, limit processed meat, those kinds of things.
So I would add to that there have been studies that have clearly shown that one of the most important things you could do after specifically a breast cancer diagnosis is to lose weight. And the outcomes for patients that do that are clearly better. And on the order of magnitude, the same benefit that you would get from chemotherapy.
Yeah, and so I don't know if that particular
level.
question was, there's an interest in weight management in that as well, but really the same principle applies is, to lose weight, obviously you have to cut your calories, but you want to pick an approach that is balanced and is something you can sustain, in the long term for years.
So maybe if you could tell us a little bit about your specific research interest in obesity and our rural populations.
Yeah, so my research is in how to implement and deliver weight loss programs to both people who've had cancer and the general population. Similar to what Ed was talking about in primary care, it's really one of the top priorities for a person for their overall health. And yet, we don't have a healthcare system that's set up to really help people with weight loss. In fact, you couldn't even bill under a diagnosis of obesity until 8 years ago. It wasn't even an option. So we're really kind of, as a healthcare system, been very slow to treat obesity as a disease. And so our work really focuses on how do we integrate these kinds of interventions into a healthcare setting. And we focus on rural because many people don't know rural populations have a higher obesity rate. And we really want to kind of get out on the front end of that and help people not only with diabetes and heart disease, but also with their cancer prevention, because it's linked to about 13 different types of cancer.
So it looks like we have another question, Megan.
Yes, we do. So this question asks, do you feel like the research supports giving up animal products in our diets to prevent cancer?
Certainly there is support for processed meat. I think that's very consistent. And there's some support for limiting the amount of red meat as well. I think the recommendation is about 12 to 18 ounces of cooked red meat, and you should be fine. But processed meats, I think, is where you can get into some risk.
Yeah. Okay. So we're getting close to the end of today's episode, and perhaps we should end with some of kind of the top cancer prevention tips from both of you. Ed, I know what yours is.
So I think we just have to be one of the key concerns and advances here is we're having a lot more head and neck cancer in this country. And wouldn't it be wonderful if we had a vaccine against cancer?
What a great idea. We should start working on that.
Well, but I understand now that they actually have a vaccine against HPV.
Who would have thunk it?
And so if anybody here is under the age of 26 or between the age of 11 and 26, getting your HPV vaccine is the easiest decision you can make if you want to take an effort on reducing your risk of cancer. We really do have a vaccine. It's for boys and girls, or men and women. They've upped the age now to 26. And frankly, in Australia, they're virtually eliminating these HPV-associated cancers because they're getting that vaccine out to everybody. And we need to do the same thing here in Kansas and the U.S.
I would add one more if we're talking about younger populations, lifetime prevention. If you're a mom or going to become a mom, breastfeed your baby. It's a great way to reduce your breast cancer risk. It's good for the baby, it's good for the mom. 6 months, try to stick with it for 6 months, 12 months if you can.
That sounds great. Well, Dr. Elbeck and Dr. Beffert, thank you for both being with us and a part of this week's episode of Bench to Bedside. That's it for today. Please join us next week at 10 a.m. for Bench to Bedside. Thanks for watching.